Good evening, I'm Barkha Dutt. This is the Mojo Story, our independent digital platform that does a deep dive into one big story every day. Today, we're taking you inside what is clearly India's second COVID wave. Will it be worse than last year, or is there something that we can draw hope from, given that we now have a vaccine, which is the critical difference between 2020 and 2021? But first, let's take a look at the data. India has crossed the 1 lakh daily mark in terms of new infections. This is the first time ever since the outbreak of the pandemic that this has happened. Maharashtra continues to be the worst hit state with the highest single day spike in Mumbai, which now has over 11,000 cases in the last day alone. The state of Maharashtra itself is also witnessing its single largest spike, the highest ever daily surge in Maharashtra, with 57,700 infections reported in the last 24 hours. So remember, we're crossing that 1 lakh daily mark, and Maharashtra has imposed new restrictions, not a complete lockdown, but certainly a weekend lockdown, with restaurants, malls, and places of worship shutting down, and no more than 5 people allowed to gather even in the daytime. This means private workspaces are shut, whereas government workspaces continue to be allowed to function. On the program today, we're trying to make sense of this new second wave, and we're joined by one of the world's foremost experts on the subject. I follow him closely online. You can follow him on Twitter if you don't already. We're joined by Dr. Ashish Jha, who's the Dean of Brown University's Public Health. Thank you, Dr. Jha. Welcome to the program. As you know, COVID has been some sort of personal obsession for me as a journalist. I've devoted pretty much of the last year traveling across India reporting it. And, you know, we had reason to believe in the beginning of this year that we had done much better than the rest of the world. Certainly our IFR, in terms of how many people were actually dying, was much better than the rest of the world. Now we're looking at a 1 lakh daily spike, joining countries like the United States with that kind of data. I know that you said that the second wave might be worse than the first. Some might say you're being alarmist, considering our mortality is nowhere as bad, even now under 500, and recovery rate close to 93%. What makes you think that the second wave in India will be worse, Dr. Jha, than the first?
Yeah, so first of all, thank you for having me on. You know, this is, India has been a very kind of interesting situation with COVID, because case numbers declined quite substantially in the fall and winter in a way that I think many of us were not quite expecting. But the problem is that much of the Indian population is still very susceptible to this virus. And so this second wave is not totally surprising. And I guess what I've been worried about is how quickly case numbers have risen compared to last time. And India has had a lower fatality rate, partly because it has a younger population, which is very, very helpful. But as I look at India crossing 1 lakh cases, I wonder what's going to stop it, and how do we slow down the spread of this beyond hotspots like Maharashtra and make sure that it doesn't become a nationwide problem, the way it has in almost every other country where this virus has taken off.
Are you a supporter of lockdowns? And I ask you this because when I started covering this story in the beginning of 2020, I thought, like many other people in the world, that lockdowns were an inevitability. But at least in our country, I would argue that lockdowns have penalized the poorest citizens and not necessarily offered any sustainable containment of the virus. I compared it in a recent column to trying to get fitter by going on a crash diet, that sooner or later you'll put back the kilos and you'll have other health complications as well. The lockdowns were meant to give breathing space to the health system. They were not meant for the world to go into lock and key. Given the numbers you're seeing in India, would you support the kind of restricted lockdowns we've seen states like Maharashtra embrace?
Yeah, so lockdowns to me, I very much agree with you. Lockdowns to me are the very last resort. You only do that when things are truly out of control. But lockdowns are not a good long-term strategy because you can't sustain them. And as you said, the poorest suffer the most. So you want to use them very selectively for short periods of time to get the virus under control. But what you really want to do is be on top of it, be proactive. So when case numbers start rising, you want to start putting in some restrictions. I think mask wearing is incredibly important, and that should be widespread and should be mandatory It's a very good alternative to lockdowns. More testing and tracing and isolation is another really important strategy. If none of those work, then you find yourself doing the kinds of restrictions Maharashtra is doing. But to me, that's really the last resort.
Mhm. I want to go back, though, to your original apprehension that this could be a worse second wave. Now, we're getting conflicting feedback. I'm going to start traveling again very soon myself, but right now, talking to doctors, we're getting a conflicting sort of feedback. Almost all of the doctors at the front line treating COVID in India say that this variation of COVID, or this variant rather, and there are multiple variants, but the one they're encountering, for example, in Mumbai seems much more communicable, therefore more easily contagious and passing on from person to person, high level of contagion, but not necessarily more lethal. Now, I don't know if this is because doctors have got better. We know a lot of things that we didn't know last year. We know, for example, that we need high flow oxygen more than ventilators. We know that hydroxychloroquine doesn't work. We know that there's not much you can do except give paracetamol and steroids if they're needed, the latter if they're needed. We know a lot more, right? So I want to understand where your apprehension about the second wave is coming from in India.
Yeah, my apprehension really comes from a couple of things. First, I think last year when India went into a lockdown, there was a lot of course, fear. We didn't know what the virus was going to do, and people were generally very compliant. Over the last few months, I think a lot of Indians, speaking to my family in Bihar, a lot of people sort of feel like the pandemic is over and they want to get back to their lives. And what I'm worried about is as cases spike, will people really follow public health guidance and avoid gatherings, avoid crowds? I'm worried about elections that are happening in many parts of the country, and they will draw crowds. I'm worried about things like the wedding season, and there will be weddings and other celebrations that will cause more gatherings. So there's a lot of things that are going to potentially drive case numbers higher. No doubt about it, we've gotten better at treatment. I think the average person getting infected today probably has half the chances of dying they would have a year ago because of those improvements in treatment. But that said, 100,000 people, 1 lakh people getting infected, that number could easily keep going up. That's a lot of people infected and will lead to, unfortunately, a lot of deaths and could end up surpassing what we saw in the first wave.
You mentioned elections, and I want you to speak a little bit about that, right? Because one of the things that we are seeing, and this is across parties, so it's not really about one political party or the other, but if you look at these images, and I'm sure you've been seeing them, the government on the one hand is asking governments, I should say, because state governments and the central government are asking people to follow COVID-appropriate behavior, and this is what we're seeing at election rallies. But life does have to go on. I understand that as well. If you look at these pictures coming out of India of the election rallies, what would you say? Would it have been your recommendation to postpone elections? Would it have been your recommendation to have 1 seat apart, the 6 foot ki duri, with what the Prime Minister calls it, even at chairs placed at these election rallies? What would you say about elections? Or would you say, why do you need to hold elections right now at all?
No, this is complicated because elections, of course, are very important for any functioning democracy. And what I would say is, there are ways of making things safer. Keeping people more distant, more apart is important. Getting everybody to wear a mask. In those pictures, we saw almost no one wearing a mask. That to me is unacceptable. You can get people to wear masks, make them mandatory for rallies, hand them out if you need to. There are many things that can be done to make these outdoor gatherings safer. Again, canceling elections should be really the last resort. But they're not even trying to do the things that we can do to make those election rallies safer.
Yeah, I want you to try and decode a little bit of what's happening in India that makes it different from the rest of the world. And I know that other medical experts have weighed in on this. I remember interviewing Siddharth Mukherjee, who's an immunologist and an oncologist, and he said it was one of the big mysteries, the fatalities, and that science didn't actually have the answer right now to this. The other mystery that I have spotted is that, and I don't know if this is happening because there's not enough testing going on in rural India, but this is very much an urban phenomenon in India. COVID is a product of urban India. Those in rural India seem much more immune, even if they are getting COVID and we don't know because they're not getting tested. It seems that most of them are asymptomatic, and serological surveys did seem to point in that direction, even for our cities. What are some of the things that leap out at you about the numbers and the cases from India that strike you as somewhat unique compared to the rest of the world?
Yes, this has been one of the mysteries of COVID. And first people thought, well, it has to do with kind of hygiene hypothesis in lower income countries. But we've seen very bad outbreaks in places like Brazil, which in many ways is like India in terms of the similar population, similar incomes. So I don't know that I completely buy that. There are other theories about the BCG vaccine, and maybe people who've gotten the BCG vaccine have a milder form. Again, that has not been borne out for sure. So there are a lot of theories out there, and I have to say that I am not sure what explains the fact that places like Bihar, where my family is, when I speak to them, this is not having a profound effect in more rural parts of Bihar. And it's a bit of a mystery to us because in other parts of the world, and not just in high-income countries, but in South Africa, in Brazil, in Chile, in lots of places around the world, we're seeing cases begin in the cities, but then get into the suburbs and get into the rural areas and really devastate communities. So I'm thankful that's not happening in India, but it's still a little bit of a mystery.
Can you get the members of your family in Bihar to wear masks?
No.
Do they wear masks? No?
I talk to them and they say there's no problem here. Everybody is fine. So why wear a mask? As you might imagine, for me, this is extremely frustrating because I go out all day and I speak about wearing masks, and yet my own cousins, I can't get to wear masks in a reliable way.
What do they say? Where in Bihar are they?
They're in Madhubani in northern Bihar, and they're mostly, they say that everything there is fine. There are a few cases here and there, but my sense is there's not a lot of surveillance happening, so there may be more cases than we know, but again, it's not getting picked up. So for a lot of people, it feels like the pandemic is over or that it's overstated.
Yeah. And you're saying that Dr. Ashish Jha cannot convince his cousins in Bihar, in Madhubani, to wear a mask. You need to start taking this personally. But I know exactly what you're grappling with, because you just cannot, like, I've traveled extensively across rural India. Nobody wears a mask in rural India, and you just cannot convince people. And you don't even know what to say to them. They actually think COVID is one grand conspiracy, which of course it isn't. But there is a class dimension very much in India to what we're seeing happening. And that is why I'm against lockdowns, because it's almost as if, the middle class and the upper middle class are the COVID patients, and lockdowns then punish the poor. I wanted to talk a little bit about the argument around mutations and variants, and I ask you this because what I want to understand from you, and I know you've had some concerns about whether the genome sequencing is extensive enough in India, and that is really the only way you can study how the virus is mutating. Now, we have a little bit of information on how the mutants have been taking shape. There's the infamous double mutant in India, which is being spoken a lot about. It now appears to have traveled across the borders to California as well. We saw that media report on American television in the last 24 hours. We're also seeing 736 samples that have tested positive for the Kent UK variant. So that's happened. These are the official numbers from the government. These numbers could be much higher. This is what we have from the government. And in fact, there are 18 states in which the government says there are variants of concern. Now, Dr. Jha, the virus can mutate for years, right? It can mutate for years. At some point, it seems to me, and I am not being cavalier. I'm just asking a layperson's question here. Can our lives go into lock and key for as long as the virus keeps mutating? Because that could be forever.
Yeah, and it need not. No, the answer is, of course, no, and it need not. The key here is there is a way out of this pandemic, and that's vaccinations. And if we can get vaccinations out, especially to high-risk people, older people, healthcare workers, and then middle-aged people with health problems, that would be hugely important in preventing severe illness and death. And that's what we care about. Again, lockdowns, to me, I want to reiterate, are the measure of last resort when everything else has failed. And my personal feeling is we haven't been doing enough. We've watched this spike in cases over the last 3 weeks. There has not been enough action. The key policy is to act early. So as soon as you start seeing an increase in cases, push masks, start doing more testing and tracing, start isolating cases. Don't wait until you have a spike of 100,000 in cases. But then you may be forced into a short-term lockdown, but get out of it quickly. and have a strategy for staying out of it. That's what country after country has done that has done this well.
Well, some countries have been, I mean, the United Kingdom, now being applauded for its vaccination rollout, has gone into the kind of absolutist lockdown that India tried last year and really had to pay for. We are not looking at countries doing short-term lockdowns. We're looking at countries, France has now gone into lockdown. The Western world seems to be panicking to maybe the other extent, taking it to the other end of the spectrum. Would you agree, or do you think they're handling it right?
Well, what the problem with the UK when it went into its severe lockdown was because basically the hospitals were completely overwhelmed. There were no hospital beds in many, many parts of the UK. There were, in the US, California, for periods of time, there were no beds in large parts of California. And of course, people need hospital care, not just for COVID, for other things as well. So when you get to that state, you don't really have much in the way of choices. This is why I've always said you want to act early and avoid that situation. But right now, the focus has to be on vaccinating people, because that's how you prevent future lockdowns and how you prevent future spikes. And it's how you prevent future hospitalizations if you go target high-risk people.
I want to take you through the vaccination numbers as they stand now. And this is the latest number we have. We have 75 million vaccines done. Of course, as a percentage of the population, the number is still too low, but in terms of absolute numbers, it's a pretty good number when you compare it to other countries in the world. So 75 million vaccination doses are done. Maharashtra, the worst hit state with 61% of the cases, has 7 million vaccination doses done. But we are still following, Dr. Jha, a staggered approach to vaccination. We're now saying everyone above the age of 45 can walk in and get this done. Personally, I think this might be a mistake. I think that the worst hit areas should be allowed a sort of universalization of vaccination for everybody above 18. But of course, that raises ethical dimensions. Other states would start objecting and so on. How do you see the vaccination numbers coming out of India?
Yeah, so no doubt about it. India, I think, is doing a good job. I think after basically US, UK, India are the three countries that have done the most number of vaccinations. But of course, India is a big country, so we've got a long way to go. For me, the priorities would have to be healthcare workers and people over 65, because they're the ones who really get sick. Now, I agree with you that in hard-hit areas like Maharashtra, expanding that eligibility to a broader group makes sense. In places where there are not very many cases happening right now, you can hold off and vaccinate that population a bit later. That would be a very reasonable strategy, to surge vaccines where infections are surging. That has been a strategy other countries have used. I think that's pretty reasonable. But right now, focusing on vaccinating as many people as possible, especially in hard-hit areas, I think is absolutely critical.
One of the peculiarities of the Indian situation is vaccine hesitancy. We are still vaccinating well below production capacity, and this is not because we do not know how to run mass immunization programs. The eradication of smallpox is one of the big success stories out of India. This is a country that produces and manufactures 60% of the world's vaccines. So vaccines is something India knows how to do. But there's so much misinformation. So there's rumor mongering, but one of the most common questions that we get from people is, so-and-so got the vaccine and 10 days later they still got COVID. We are not able to somehow explain to people that you can still get infected after the vaccine, and the vaccine is trying to protect you against disease, not infection. Could you, if you had to do a mass communication message on this to our audience watching right now, because this is the most common question we get the whole time. What's the point of getting vaccinated? So-and-so got COVID 10 days after the vaccine. How would you counter this? Sorry, give me a second. Yeah. Give me a second. Go ahead. Yeah. Yeah.
So the first thing I would say is it takes about 2-3 weeks for the vaccines to work. So you can't expect to get vaccinated today and then be protected tomorrow. It takes a couple of weeks. So that's first. Second, while the vaccines are very, very good at preventing infections, what they're really amazing at is preventing severe illness and death. So look, there are going to be people who are going to be vaccinated even a month after vaccination will occasionally get infected. But what they do is they protect you from getting very sick. They prevent you from having to be hospitalized. They prevent you from dying. And that's what we care about most. So these vaccines are really extraordinary, especially Covishield, for which there's very good data. It's been the strategy that the UK has used to drive hospitalizations and deaths close to zero. And it is absolutely essential that people get vaccinated, especially high-risk people.
Yeah, but look at the skepticism around Covishield, which is, of course, in Europe known as AstraZeneca, manufactured in Pune, in India, a bulk amount of it, over this blood clots sort of phenomenon. And nobody is actually telling you that if there have been 30 people who got those blood clots, 7 of whom died, yes, but that was 30 people in millions of vaccines that were given safely, right? So context is important, and there is perhaps no medicine in the world that will not have an outlier adverse effect on somebody. Why and how do we address this notion of vaccine hesitancy? Like we're seeing even healthcare workers hesitating to get the vaccine in India.
Yeah, I think that
wastage, 6%, more than 6% nationally is the wastage figure, by the way, which is criminal.
it's really amazing. I mean, I think what people need to understand is that even the safest medicines have some side effects. And these vaccines, for instance, are much safer than most antibiotics that people are happy to take. And in terms of the blood clots, very, very rare. They do happen, but they're very rare. But they're far less common, for instance, than getting blood clots if you get COVID. So if you get COVID, your risk of having blood clots is dramatically higher than your risk of blood clots from these vaccines. So nothing in life is 100%, but these vaccines are about as good a set of vaccines as we've ever developed. And I have gotten vaccinated. I've encouraging all my family to get vaccinated. And
could you convince the Bihar cousins to get vaccinated, if not on mask?
They're still pretty young. I mean, they're not in the highest risk groups. But I have other, older aunts and aunties and uncles who I have absolutely encouraged to get vaccinated where they can.
The other debate around vaccines is whether the vaccines can get ahead of the mutations. And, we have some data on some variants and we don't have on other variants. And I'm personally troubled by the fact that every time we have a new sort of article out in Lancet or, one of you sort of big experts telling us that the vaccine is not so strong against so-and-so variant, we actually end up discouraging people from getting vaccinated. A kind of fatalism sets in. And also the world then tends to, hunker down and go into a sort of island mode again. How do you see the whole debate around vaccines and the mutants?
Yeah. So my take is, first of all, most of these variants that are out there are very susceptible to almost all the vaccines we have. There are occasional variants that challenge vaccines. The South Africa variant, for instance, does not. The AstraZeneca vaccine does not seem to work as well against the South Africa variant, the Covishield. That said, again, we're looking at country after country, like the UK. It's used Covishield, and it has done a fabulous job of bringing infections and hospitalizations and deaths way down. So I remain very encouraged about these vaccines. They're not 100%. We may need to make changes in the future to deal with some variants. But right now, the single best strategy for ending this pandemic, for getting out of lockdowns, for putting this all behind us, is getting people vaccinated.
Yeah. There's been some talk about mixing and matching vaccines. We're seeing that conversation take place in India. There's a question about that. In fact, for you, hello, Dr. Jha, is there a risk of taking Covishield now and taking Covaxin a few months later? Covishield, according to this person, is not very effective against the South African variant, according to experts. And this is what I'm worried about. I think everybody's going to become Dr. Google. People are just going to Google it. They're going to go to their doctors. They're going to argue, this is the vaccine we want. This is what we've read. And I think we should just take whatever vaccine we get. But the mix and match question is an interesting question.
Yeah, so I would say, first of all, people should absolutely get whatever vaccine they can. Second, on the issue of mix and match, we don't know. And I think we need to study this and we need to understand it a bit better. My sense is it's probably okay, but we should really do the studies to assess whether that is true or not.
Mm-hmm. Another question is, and I brought this question up because I was having this argument with somebody in government, and I said, why has India been so conservative in granting permissions to, let's say, Pfizer, Sputnik, we've asked for bridging trials for these vaccines. And the answer was that there is a kind of genetic specificity that is possible to how people react, how populations react. So the question is, in that context, why is the Oxford AZ, that's AstraZeneca vaccine, causing thrombosis in Europe but nothing in India? Firstly, we don't know that it's causing thrombosis. I just want to say that this is a very generalized thing. Again, I'll come back to the data, 30 people in 5 million doses, that was the number. But do you believe that you need country-specific trials, or is India making an error in delaying the availability of other vaccines that it could authorize emergency use for almost immediately?
Yeah, I don't think you need country-specific trials. Humanity is humanity. People are people. And we have not seen any real differences in how these vaccines work in Indians versus Americans versus Brazilians. So I don't think you need country-specific trials. I think we should be able to use data from other places to authorize vaccines in India. And I would very, very strongly encourage that the Indian government do that.
What are the mistakes you think, looking, from your perch there, that you think India might be making that needs to change, like almost immediately? Obviously, one of the things is to allow as many vaccines as you can. What might be the concern that leaps out at you above everything else from India?
Yeah, absolutely. Get as many vaccines in as you can. Vaccinate people. I think the messaging around where we are with this pandemic, it needs to change. It has to be, again, I don't think we need to be thinking about lockdowns and all these things for a long period of time, but we have to say to people, we're in a crisis right now. We've got to get through it. I think there should be a lot more positive messaging about mask wearing. Again, these large gatherings we've got to hold off on. But basically, this is a pandemic. And India is not going to be immune to a global pandemic. And what we need is a very clear, well-articulated strategy about what needs to happen in the weeks and months ahead, how people get their lives back to normal, and how we get beyond this pandemic. I don't feel like I've really seen that kind of forward-looking, positive strategy for what India needs to do. That strategy is what people are going to be able to look at, follow, and have. If people have a sense that this will go on forever, you'll see a lot of hopelessness, and then you'll see people not complying with public health measures. And I think that's what's really important.
And that is my problem with lockdowns. I mean, the more we push countries into closure, the more people are actually just going to give up. It's almost such a hopeless situation that you have nothing to look forward to. Give us a sense, finally, of what's happening in the US. Biden's done a good job. He's done better numbers on the vaccination rollout than even his own promise. But again, we see so much talk about mutants and variants. We can't get obsessed with this, can we?
No, and I think America is actually doing a very good job right now on vaccinations, 3 to 4 million vaccines a day. I think there are some variants, some cases rising in some places. I expect within a month to 6 weeks, America to be in a much, much better place. And that, I think, will put this pandemic in much better shape for America, certainly by the time we get to the summer.
Final question. There are already questions about a third wave. My concern is that I think we've got to mask up, vaccinate, and live. My last question to you would be about vaccine passports and whether that is going to be a way to get back to reclaiming some amount of normalcy. What will you say on that?
Yeah, I think we're going to see different places do this differently. I don't know that we're going to have government-issued passports, but I do think that you're going to see a lot of private companies push for this kind of thing. In America, across Europe, people will want to know if you're vaccinated or not.
And so, do you, in principle, support vaccine passports or vaccine documents?
I think it's inevitable. I think it's inevitable, no matter how we handle it.
All right. Pleasure having you on the program, Dr. Ashish Jha. Thank you. I overshot a little bit of the time we had with you, but we were being a little greedy. Thank you. Have a great day. And thank you so much for helping us learn better and learn more. And hope your cousins in Bihar are watching this program and are a little bit more convinced to mask up. Thank you very much.
Bye-bye.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.